The WHO has said the risk of global spread of the Ebola outbreak in Congo and Uganda is high, but globally it is low. This after around 600 suspected Ebola cases and 139 suspected deaths have been reported so far. Officials warning the numbers are likely to rise as the virus had been circulating undetected for some time before the outbreak was identified. Of these, 136 deaths in Congo are now suspected to be linked to the rapidly spreading Ebola outbreak. The virus has already crossed borders into neighboring Uganda, where 2 confirmed cases, including 1 death, have been reported. The WHO has declared the outbreak a global public health emergency, warning that the situation is evolving quickly.
Beyond the confirmed cases, there are almost 600 suspected cases and 139 suspected deaths. We expect those numbers to keep increasing, given the amount of time the virus was circulating before the outbreak was detected.
Officials warn it could take months before any vaccine targeting this rare strain is approved and available for use. As of now, the WHO has deployed experts, tents, infection control kits, and emergency medical supplies into the affected areas. The U.S. Secretary of State has said the WHO was a little late to identify the outbreak, while the organization stresses on the challenges of operating in conflict zones with limited access and weak health infrastructure due to the steep funding cuts. Treatment centers in Congo are already under pressure, reportedly, with some hospitals in eastern Congo full of suspected Ebola patients and struggling to isolate new arrivals. Officials fear the risk of burying victims without proper protective equipment.
We need funerals which, in the past, used to be held with the whole family. But now, unfortunately, we have to adopt a different way of burying the bodies. Because it is often, as you've heard, it is often during funerals, when families gather, that infections spread.
The outbreak started in eastern Congo's province, a densely populated gold mining region near the borders of Uganda and South Sudan. The Congolese are now seen wearing face masks again, fearing a repeat of past Ebola crises that devastated communities.
One person infected with Ebola can infect more than 5 people. It's very dangerous. We are truly afraid of this disease.
Meanwhile, neighboring countries have increased border monitoring and health screening, with Rwanda even closing down the Goma border crossing. Other countries have also stepped up airport screening and visa restrictions for travelers linked to the outbreak-hit regions. And for more on these developments, our correspondent getting us this report. Take a look.
Between calls for calm and growing fears on the ground, authorities in the DRC are battling a worsening Ebola outbreak, now classified as a public health emergency of international concern, although not yet a pandemic, as clarified by the WHO. President Felix Tshisekedi has urged citizens to remain vigilant as the virus has killed more than 130 people, with hundreds infected. Panic is spreading amid reports that there is no vaccine for the latest strain, while some health experts believe the real number of cases may be higher than officially reported. Meanwhile, the head of the World Health Organization has defended the agency against criticism of its initial reaction, insisting the focus remains on containing the virus, not politics. From Lagos, Nigeria, Louisa Olaniyi, WION, World is One.
To stay up to speed with the latest news, download the WION app and subscribe to our YouTube channel.